My topic today is going to be about medically assisted suicide and why you should support it. Medically assisted suicide. Think about it. A doctor, someone who is tasked to save us, offers us a way out from the pain. How would you feel? Conflicted? Scared? Relieved? These are all the emotions and feelings of those in terminal pain, given the choice of being able to end their pain through suicide with the help from their doctor, of course. Medically assisted suicide is when a doctor gives the option for a patient to essentially kill themselves using medicine. It is legal in a few states, and often the patient has to meet a set of requirements to even consider it. Now, you're probably wondering why I'm talking to you about this, a young, healthy, young adult. Well, you guys probably have a lot of older family members that maybe they aren't going through anything, but potentially in the future they may have some complications. Hopefully not. That unfortunately they have no control over, but can only simply deal with till their time comes. This would allow them a choice and a lot of the frustrations that they can talk over with the professionals to determine if it's the best course of action. I've done a lot of research regarding the topic of medically assisted suicide, also including philosophical aspects to consider, as there are a lot of ethical implications. There's a need for medically assisted suicide because there are a larger amount of people who are terminally ill and are in a lot of pain. Legalizing medically assisted suicide would allow for this to happen. It would be positive because it would give those that don't have a choice in the pain an option when they never had one. Let's begin by discussing there are over 19 million people within the US that have a high impact chronic pain. This means that they are impacted daily through the amount of pain they have through their disease. Within hospice care as well, the population is over 1.9 million according to the CDC. The number is only growing, and there is going to be a population consistent with that number, if anything, even higher as time goes on. With talking about this, there may be conversation about how it may not be ethical because they may allow for almost any person who has some sort of medical situation going on, whether they faked it or fabricated it. This makes it so that there could be loopholes that one can take to using this medically assisted suicide concept. Although personally none of you may be affected, there may be a close family member or someone that you know that is going through a lot of pain that they can't control, fix through any medication or surgeries or things of that nature. This would allow them a way out of it all. I know it sounds a little bit crude, but sometimes this is the option that many patients feel. I hope this allows for you to broaden your thinking and support on this. Support for this or even conversation would allow for a step closer to the legality of medically assisted suicide. To legalize medically assisted suicide, spreading the word or at least having a thought on it helps a lot more than people think. I want people to realize that there's an option like this if they ever find themselves in a situation where they ever consider. It is also a lot safer, as the suicide method would be done in the safety of a hospital or a location that the doctor gives, and it is controlled by the health professionals. And this is seen through the source of Death with Dignity, an advocate group. The way that this would work would be through a group of medical professionals. They would consider the situation and how long the patient has to live. Considering in the states that allow for medically assisted suicide, the diagnosis needs to be 6 months left to live. In the new legality, potentially there could be a range of months, such as 6 to 10 months, and in special situations, a year. This is to ensure that all can be done to save the person and not make it too long of a time period so that anyone can do it. It broadens the spectrum for those that are already in this type of hospital situation but did not have the means to do so because of financial reasons or legality. Now you might be wondering, is this even okay? What are the ethical implications? To let someone who has so long to live the option to die, why not let them live it out? There are many reasons to consider this. A financial standpoint, many people pay to have their medicine and care. This can add up over time, creating debt for a family that can't withstand it. It can often be a hard decision, but allowing relief for a family that has medical debt is something that would be very beneficial. Another perspective to consider is the amount of pain someone is going through. It can be a lot for people to go through every day because it's just a day in and a day out of the hospital, not necessarily being able to enjoy the daily things of life. This is a way for them to end that suffering in a safe way. And these arguments could be seen through the Journal of Ethics. Looking at this, looking into the future, I believe this would be a positive implementation for the future because it gives a safer option for those that do not want to continue dealing with the pain of their illness or situation. This gives a choice, one that they didn't have before. If this problem isn't solved, then you will have to look at the amount of people that are in pain and have to endure paying for their bills that they don't want to pay for but must to stay alive. I know that this was probably a lot to take in, but it is a topic that must be talked about. I encourage you to talk about it sometimes with people that are comfortable debating the topic. It's something that is not necessarily talked about outside of an educational setting, but it would allow for it to be normalized or even just debated. Personally, I've talked to a lot more people in my friend group about this topic, and I was able to gather their opinions and their stance on this topic. I hope that you've gained enough information about this, and when you think about medically assisted suicide, think about someone close to you that may be in this situation financially, through the pain that they're going through. I also want you to think that maybe one day it can be even you. Thank you.